My name is Betty. Go by hers and she's. I am part of the Charles Drew Cares University. I'm an HIV counselor and a tester here on for ACEs Clinic and also at THC Clinic. Pretty much, we're going to talk about what couple of questions that most of us, just to spare awareness, more of a, HIV, the HIV program, the HIV testing and prevention and all that. So I have a few questions, right? So what inspired you to keep doing this work after your first few tests? Honestly, what really inspired me to this day is coming to work every day, is knowing that today or tomorrow or the next day, I could change someone's life. Whether it's good or whether it's bad, a positive or a negative, is being able to give someone that closure and also the peace of mind. It is not easy to give someone bad news. Definitely not. But giving them all the support they need, walking them through the process, educating them, sparing awareness, even whether it's linkage to care or for prevention, for PrEP. My job is to make sure that I'm just here, spreading awareness for HIV, to get tested, encouraging them to get tested, and for testing place. Well, the first thing is letting them know that everything that is confidential. Remember that there's still a lot of stigma around HIV services and why is the need to get tested. It's very important. It is. To make them feel comfortable, to make them feel safe. Questions that we ask that are confidential within in the room while they're doing the process and the consent is getting to know them for them, and also educating them about the high risk. How do you make people feel safe when they walk into your testing room? Well, first of all, is to make them feel that everything is confidential, they are in a safe place, and also making them feel they're not alone. Remember, there's still a lot of stigma around within the HIV epidemic. So as an HIV counselor and a tester, my job is to make them feel as most comfortable as they can. And also for me to kind of like engage to what really are there in high risk, what other services they might need besides an HIV test, an STD screening, are they using any type of needles, sharing needles. It's very important to make our clients and the people that come into these doors when they get tested to make sure that everything stays confidential. What challenges do you see that aren't talked about in the media or at any public campaign, right? Well, there's a lot of stigma. I feel like within the media, like social media, I feel like more promoting that, HIV testing, it is important. It's part of our health. And once again, it's just spreading awareness because to this day, there's still a lot of stigma. Just to make sure that the communities that we do stay around with folks is spreading awareness through media or sharing our thoughts, getting together, with other agencies or other campaigns where we could come along and really spread awareness for those that are people that probably haven't even been tested for HIV, right? So, working in the HIV field really, really has impacted me in many ways. Wish people understood better when it comes to Latinx health. It's being aware of all the good resources that is now available, whether it's linkage to care or prevention. I want people from their own culture to understand in the Latinx community, it's about spreading awareness, breaking barriers that is either holding them back to getting tested or, seeing even a provider, right? Because of so much stigma that is still going on today, and it's still happening today, it makes it really hard when it comes to, barriers like that. Taught me about love, fear, and humanity. It taught me to love what I do for a living, because without love in this field, the type of things we go through as HIV counselors, it teaches me to love harder for those that need love or even a hug. Someone that is, someone to actually make them feel sincerely cared for. And fear taught me that it's okay to cry, because if fear is not in my emotions, feelings, then that means I have no feelings at all. Fear that if I am not at work one day, right, and I have felt someone from getting tested, or what if they were HIV positive, that's a fear for me, because I could have been saving somebody's life. Now, humanity taught me when they need to get a test, we both walk through it together. We all equal, and we in this together, and also they're not alone. Being an HIV counselor, I've been doing this since 2018. I started in Skid Row with Wesley. And at some point, I did want to give up, because I just couldn't pass, right? So finally, when I passed my counseling and became HIV counselor, being in the field, testing every day, constantly every day, it's a hard work. It is, comes with hard labor, but I love it, and this is the reason why I'm still here today. It's for them, it's for all of us, and it's to continue, that path of giving everybody hope, that whether you're dealing with HIV diagnosed, that you can still live a long, healthy life, and there's people that really care about you. And I learned down the road, since 2018 to now, almost 8 years being an HIV counselor, I've learned. I have cried, I have been overwhelmed. It's not easy giving a bad results, but also giving them hope, that there's hope in the end of the tunnel. What gives me hope as an HIV counselor and tester for our next generation is pretty much educating them, inform them, getting them to know their status is a big part of our lives. Is our health and hope that those that are living with HIV, there is hope to live a long, healthy life, and to continue spreading awareness for the next generation and the next generation after that. That it is important to do, to get tested for HIV rapid tests. I think